Or Elementary. It's Nurse Kelly with your tips on a Tuesday. Today's topic, nosebleeds. It's that time of the year. We're turning the heat on. It's getting a little chilly outside. Um, the heat tends to dry out the insides of our nose and the mucous membranes, and it dries out the tiny little capillaries that are inside your nose. And so you're at risk for even just touching your nose a little bit, and it starts that nose to bleed. Sometimes in the middle of the night, you may wake up, or in the morning, you wake up and there's blood all over your pillow. I know I've met lots of students who that happens to. It happens when we're in school, right? And those classrooms start to get hot. All of a sudden, you're sitting there and on your nose starts to bleed. So, what are you supposed to do? So don't lie down. Sit up or stand. Use tissues or a damp washcloth to catch the blood. Tip your head forward. Don't lean your head back. When you lean your head back, your nose and your throat are connected, so that blood is going to run from the back of your nose down to your throat, and you're going to choke on it. Pinch the soft part of your nose together just below the bony part, so right about here, and breathe through your mouth. Do this for at least 10 minutes, and make sure you hold the pressure for 10 minutes without stopping. It sometimes seems like a really long time, but 10 minutes is usually good. Some of you may remember that when you're in school, if I'm having a hard time stopping your nose from bleeding, I may put a pack of ice at the back of your neck, and that seems to help with, along with pinching, not as a single treatment. So, but if your nose doesn't stop to bleed after 10 minutes or it's starting to get worse, you can pinch it for another 10. But then if it still hasn't stopped, then you're probably going to have to get someone involved, and maybe they'll need to take you to your healthcare provider. But what's really important, and lots of you have had nosebleeds, you've heard me say this before. Once we have stopped that nosebleed, do not pick, rub, or blow your nose, because then this starts it all over again. You need to wait about 15 good minutes after that nose has stopped bleeding in order for us to make sure that it's totally stopped. So no picking, no rubbing, no blowing, nothing like that. So that's your tips on a Tuesday. Have a good day. Hope to see you all soon. Miss you. Thanks.